Chapter 2, 14 points. So the following are some of the common events that many often experience en route to transplant. These are the very basic steps of the process. They're as simplified as possible, but we know there is nothing simple about transplant. Unless you have been touched by transplant, it's nearly impossible to grasp any part of the journey. The steps towards transplant are different for each organ, so let the facts that I'm going to talk about just be a guide. Most of the examples that I'm using here relate to hearts. However, the basic process is the same for any organ. Number 1, a referral is made by a doctor, a cardiologist, nurse, or the patients themselves. You must have insurance. Insurance card copies are obtained and approved for initial cardiology appointment. Number 2, the patient sees a cardiologist or a specialist dealing with that organ, and it's decided then if the patient is an acceptable candidate to complete a full evaluation. Number 3, authorization is obtained by the transplant program from the insurance company. So at this time, the benefit summary for surgery, hospitalization, and medication is approved. Number 4, the patient is called and an appointment is scheduled for the full evaluation. Patients are required to complete 1 to 2 days of evaluation at the transplant center. Many may need help with housing or transportation for those appointments if they live far away from the transplant center. Housing pre- and post-surgery is generally a big issue. In fact, it's a huge issue for some. If they live too far away from the transplant center, they have to stay over right by it. Also, not every state performs transplants for every organ. For example, at this time in 2016, January, Nevada has only one transplant center, which only performs kidney transplants. Many transplant centers do mostly one type of organ and very few of the other types. Number 5, the patient meets with the transplant team, which generally includes the nurse coordinator, the surgeon, a psychiatrist, a financial coordinator, a social worker, a nutrition or dietitian, and hopefully someone who has already been through this amazing journey. The financial coordinator will inform the patient of how much surgery and medication will be and what will be their responsibility to pay. The social worker will discuss options about where they might stay pre- and post-transplant, offer advice on different directions to take regarding things like disability, Medicare, Medi-Cal, and that kind of thing. Number 6, a full evaluation is made. This includes some of the following tests, depending on the diagnosis and the age of the potential recipient: blood work, chest x-ray, for hearts, an angiogram and a right heart cauterization, CT scan, carotid artery scan, leg artery scans, colonoscopy, dental clearance, ophthalmology clearance, for women a pap smear and mammogram, and consults with other specialists. Of course, each organ requires its own set of tests, and there are different tests for the two genders and various ages. Okay, number 7. Now, after all testing is complete, the patient is presented to the transplant selection committee. This committee is made up of all the members of the transplant team. For example, the surgeons, social workers, nurses, and financial coordinators. The committee's job is to decide if a patient is a good candidate, that they are not too sick or too well, and that there is no other option for them like surgery or medication. Number 8, a packet is submitted to the insurance company containing all the tests that were compiled and a letter stating the committee's decision. The approval is obtained for the surgery at the time of being listed. Number 9, once authorization is obtained, a patient is placed on the wait list for their organ or organs. Patients that are listed need to be living within 3 hours of the hospital at all times. Patients that are out of state or too far to make it in time for surgery will be required to relocate at the time of listing. Most insurance does not cover this expense. An alternative for patients who are not too far away would be the arrangement of medical air or ambulance transportation. Few insurance companies cover medical air. Number 10. At the time of transplants, patients may need to be hospitalized for a period of time between 6 days to several months. Depending upon insurance and co-pays for the hospitalization, a patient can be responsible for some of these expenses. Number 11. After discharge, the patients will be required to take all new medications. Now, without insurance coverage, medications may cost up to as much as $6,000 a month. Even with insurance, copays still may be expensive. These medications will be lifelong. Every insurance company has different regulations about it. However, if you become disabled or are a child, you get Social Security or disability, and then your medication is basically covered. However, if you are on disability, there is a loophole in the system as of right now. If and when you go back to work and earn over $2,000 a month, your benefits can get cut. You may be faced with a huge insurance donut hole at the year's end, or a new large monthly copay. It's a really complicated issue. It requires a lot of research, and we encourage you to look into it. Number 12. After transplant, it is imperative that the patient be close to his or her transplant center during the first 3 months post-transplant and release from the hospital. And when they say close to, they usually mean within 30 minutes. This is why most of Avis Heart's grants are given in the form of post-transplant temporary housing. Depending on the organ, patients need to be at the transplant center for up to many hours, almost every day, for those first few months to get blood work, tests, scans, all kinds of work, sometimes up to 8 hours, 10 hours a day. Their immune system is generally shut down, so they're usually not allowed on public transportation. Now, after that initial period, the first 3 months, patients are seen a minimum of every 3 to 6 months, and biopsies or blood tests will be done about 12 times in the first year to monitor for rejection. This is a critical time. The number of visits vary depending on the organ, and patients might be responsible for copays for each of these visits or tests. Number 13, post-transplant tests to monitor health will become part of your regular routine. Angiograms and/or stress tests will be required annually for hearts and other tests for various organs. Number 14, transplant recipients will also see their primary doctor and will have various health screenings continuously. Transplant recipients may face the following health issues: rejection, cancer, especially skin cancer, kidney failure or insufficiency, bone loss, infections, and other complications. Transplant is not a cure. It is an alternative to death. For Ava, it has been an incredible and amazing gift. She says that it has opened her eyes to who she truly is, to what she values as important, and it's taught her to approach everything with gratitude and love, and has given her the courage to forge new frontiers.